And good afternoon. I'm Tracy Sinclair, and with me is Lauren Maxwell. And earlier this week, a new report came out about drug overdose deaths here in Alaska. And those were some kind of surprising numbers. Lauren covered this story earlier this week, and I wanted you to kind of give us a little more in-depth reaction. When we're talking overdose deaths here in Alaska, what are we looking at?
Well, these particular statistics are from 2023, and I have to say, not surprising as much as devastating, because those numbers are so high. We reached a record high in that year for overdose deaths. I have some of the figures here. I think the number was 357 overdose deaths compared to 247 in 2022. And one of the interesting things, too, is the report paints a picture of who these people are. And most often, they were men. Particularly American Indian or Alaska Native. The average age between 35 and 44. They died most frequently, and most of the deaths occurred right here in the Anchorage area.
And are these are accidental, or what we assume are accidental overdose deaths?
Yes, for the most part. I can't remember. In the report it details that some were considered suicides, but that was a very, very small percentage.
When you look at those numbers, I guess on a per capita basis, how are we compared to what they're seeing in the lower 48?
Well, this is the thing that is particularly shocking, because we are bucking a national trend across the country. That same year, overdose deaths generally went down, and Alaska had the highest increase of all the states. So it's not a good thing.
Is there any indication of why that's happening? I looked at the stats after you did your report, and there's a distinct jump pre-pandemic, post-pandemic, from 2019 to 2020, and then even higher as we go through the years. Do we have any idea why we're still going up when the rest of the country seems to be going down?
It started to go down. You know, I asked that question of our public health director, and basically what she said, and I have heard this before, is that Alaska is just a little slower on all these trends. Most of these deaths involve fentanyl. We've all heard of that in some way or another. And fentanyl is certainly with us now, but we were a little slower on the West Coast just in general to get those. So we are actually mirroring some of these trends, but we're a little bit behind.
We are just, and we find that same thing in economic trends, where we're a couple years behind the rest of the country.
Yeah.
So that is interesting.
Another thing I thought was very interesting, and we interviewed some of the troopers about this, who are very involved in drug enforcement here. They told us that they are seeing more drugs come to the state. They're also confiscating more drugs. We said, well, how are these things generally arriving? They said that most of them come either through the airport, in other words, people carry them in, or they're in the courier services, by which I mean it could be the post office, through the mail, I guess is the safest thing to say, whether it's Amazon or UPS or any of those things. And they said it's very difficult to detect drugs in packages, because one package looks just like the next,
right.
So that is a challenge that they have, I think, is to stay on top of these trends of how drugs are arriving and where, and it is a challenge, apparently. Another thing that's very interesting that we talked to troopers about, some of the biggest Mexican cartels, and two of the names you may have heard before, Jalisco and Sinaloa, those are two places in Mexico that have very big drug cartels. They're responsible for bringing a lot of these drugs across the border. We asked if those were active in Alaska, and we're told, yes, they have seen evidence that both of those cartels have operated here.
That is fascinating, because again, I feel like we're a little bit isolated, and you tend to think that we don't see the direct impact of that.
Well, we asked about that as well, and what we heard was, and this again makes sense, it's very lucrative to sell drugs in Alaska. You can sell them for a lot more than you can in other places. So these dealers are willing to take a risk to come up here because their profit margins are high.
As you looked through a lot of this information this week, what was your biggest surprise? And besides the one that you mentioned, was there anything that you went and was just sort of stunned you as you read through it?
Just that those numbers are still going up when we do hear about others starting to drop across the country. I guess the good news is, though, that there is some hope. The governor has made this a priority. The Department of Health has made it a priority. We are getting more funding dollars. We're getting millions of dollars from the national opioid settlement monies. And I believe that there is about $3 million per year for the next 3 years that's going to be doled out to some of the community organizations that are fighting drug addiction, drug abuse, overdose deaths. That's a positive. and hopefully more treatment will be opening up. I wanted to mention too that we do have an article at alaskasnewssource.com. It has links to some of the pages of the Department of Public Health that tell you where you can, for example, get a naloxone kit, where you can get training on how to use that, and also some of the support services that are available for people.
Excellent. Yeah, so full story on this on our website, alaskasnewssource.com. You'll also find the video version of Lauren's story, so you'll want to check that out. It was really fascinating. Thank you so much for doing the research and the work on that. And of course, you're always going to find more on our website, alaskasnewssource.com, and on Alaska's News Source at 4, 5, 6, and 10. Join us then for more of these kinds of stories.